Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in the class of Roga Nidan Vikruti Vijnana. Roga is a disease and Nidana is a diagnosis. Actually, the Nidan has the two meanings. One is a diagnosis, Roga Nidan, but another meaning in the Nidana Pancha Panchak. When I say 5 methods to understand the disease, then Nidan, Pururupa, Rupa, Upashaya, and Samprapti. So that Nidan is a cause or the Hetu. In Srotas Dushti Hetu, that is also a Hetu means Nidana, causative factors. So, my dear friends, I have already explained that there is a very much importance of the Srotas concept in the Roganidan subject or Vikruti Vijnan subject. And the Srotasas are the macro MACRO channels or micro channels, very small, very small. For example, this my nasal cavity is Srotasa. My oral cavity is Srotasa. My trachea is a Srotasa. Huh? My digestive system, that intestine and stomach, all the lumen is also Srotasa. You understand? But simultaneously, when you consider the cell and cell membrane, there are also holes. That small holes are also called as a Srotasa. If you consider the coronary artery and lumen of the coronary artery is also Srotasa. And the total number of Srotasas in the body is innumerable. You cannot count how many Srotasas in the body. So many, too many. But 13 Srotasas are very much important. Pranavahasrotas, Annavahasrotas, Udakavahasrotas. 3 vital principles. And then Sapta Dhatu Srotasas, Rasa, Rakta, Maus, Med, Asti, Majja, Shukravahasrotas, and 3 Malas, that is Mutra, Purisha, and Sweda. Now, Ayurveda says that when the disease is created, that is because of the Kha Vaigunya, Kha, Kha Vaigunya. Kha is a Akash Mahabhut. Kha is a Srotasa. So, whenever Srotasa is a damage or not properly functioning, it has some problem, then definitely doshas will attack on that Srotasas. Now, today I am going to tell you 4 important normal function of Srotas. Any Srotas, they are performing 4 important functions. Please write down 4 important functions of any Srotasa. Number 1, Utpatti. Utpatti of that particular element. For example, Rasa Srotasa is there. So, Rasa Utpatti, creation is in the Rasa Srotas. So, Utpatti, first function. Second, Parinamana. Parinamana. P-A-R-I-N-A-M-A-N. Parinamana. That is a transformation or metabolism. So, Rasadhatu metabolism is a second function. First is a Utpatti, then Parinamana. Number 3, Vahana. That is transport. Transport of raw material, transport for the precursor, raw material for the next dhatu. So everything is moving. That is because of the Srotasa. Vahana. And fourth function is Utsarjana. Utsarjana, that is excretion. So my dear friends, please remember 4 important functions of any Srotasa. Utpatti, Parinamana, Vahana, and Utsarjana. Utpatti, creation. Parinamana, transformation or metabolism. Vahana, transport. And Utsarjana, excretion of the waste product during the metabolism. So this is in general the basic idea about the Srotas. Once again revision. Now we are already completed Pranavaha, Annavaha, Udakavaha, Dushti Hetu, Dushti Lakshana, and also the Viddha Lakshana. Viddha Lakshana is mentioned by Sushruta. I think here I have to do again one printing mistake is there. My dear friend, please excuse me. So I will try to recorrect. No, but okay, I will rectify it afterwards. Here you can see I have to make the L over there. Lakshana. Good. It has been done. It has been done. I will just save it. Okay, good. So Lakshana, Viddha Lakshana. Viddha Lakshana are always mentioned by Sushruta. Now from today, we have completed Prana, Anna, Udak, Rasa, Rakta, Mans, Meth, and even Asthi. And today I am going to start with the Majjavasrotas. Please kindly note this, Majjavasrotas. Okay. I think I can make the screen bigger if possible. Yes. Good. Majjavasrotas Dushti Hetu. उत्पेशादत्य अभिषंदात अभिघातात प्रपीडनात मज्जवाहिनी दुष्चंती विरुद्धानां च सेवनात. These shlokas, if possible, each student must learn by heart. जास्तीत जास्त वेळा वाचा. You read as much time as you want. Every day you read some shlokas. And these shlokas, if possible, if you can remember, that is a biggest achievement. But if you don't remember, don't take any tension. You should able to understand the meaning and you can tell the meaning. What is meant by that shlokas? No necessary to write down the Sanskrit every time. Okay, but if you can remember, it is also good. First word is utkshepa. That is utpesha. Utpesha. I am sorry, not utshepa. Utpesha. 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 That is crushing type of injury. Now, majja can be considered in two ways. Remember, in the modern physiology, majja can be compared with the bone marrow, which is inside the bone. And second is a nervous tissue or nerve cell or the nerves. So, majja is compared with the bone marrow, majja is compared with the nervous tissue or the nerves. So, our brain, our spinal cord, our vertebral column can be damaged by the trauma, injury, road accidents. Number two, ati abhishand, excessive consumption of substances which increase kledatva in the body. Kleda is excessive moisture. Kleda is a liquid waste part created during the tissue metabolism. So all the body, they will secrete unnecessary pathological secretions, that is kleda. Unnecessary pathological secretions are kleda, and that will block the different channels. Okay, so that is because if we eat curd lot of time or South Indian dishes, uttappa, dhokla, so all they are fermented products, and fermented products means abhishanda. They will increase the kleda and that can block the srotasas. Then abhighat, again the injury, type of injury. Then prapidana, like squeezing, by some or the another pathology, by tumor or by any pressure over there, that nerve tissues can be squeezed. That is also the problem for Majjavasrotas. Then viruddha sevana. Viruddha is incompatible food. So whenever the person eat many times, for example, fruits and the milk, banana and the milk, or the grapes and the milk, or the chikku shake, mango shake, shake, that is called as a viruddha anna in Ayurveda, because many fruits are acidic and milk is alkali. So together, mixing of these viruddha properties, viruddha guna, then that is called as a viruddha anna, viruddha ahara, incompatible food. Okay, that is here I have written incompatible food. Okay, we will go further. Now, Dushti Lakshana, Rukka Parvanam Brahmo Murcha, Darshanam Tamasastatha, Arusham Sthula Mulanam, Parvajanam Cha Darshanam, Charak Sutrasthan. This slok is from, all the Srotasas are explained in Charak Vimanstan, but some Dushti Lakshanas are mentioned in Sutrasthan. Parvanam Ruk, that is pain in the joints. Because as you know, if you consider that is a bone marrow, then if bone marrow is having some type of blood cancer type of the problem, then it can give the very severe bone pain or bony joint pain. So that is Parvanam Ruk. Okay. Then Brahma, it is related with the brain, giddiness. If there is an undernourishment of your brain cells, Tarpaka Kapha is a less because of the aging process, then the patient have the complaint of giddiness. Okay. Moving around. All the things are moving around when he is standing. Then Murcha, again it is related with the brain, unconsciousness or fainting attacks. Because I am telling you, Majja is compared with bone marrow sometimes, or Majja is compared with the brain and the nervous system. Okay. Tamodarshana, appearance of the darkness in front of the eyes. That is again because of some sensory problem or the motor problem. Basically, this is sensory problem. Then Arunshi in Parva, which are having the Sthula Mula. This is very complicated word, Arunshi. Deep-seated ulcers in the joints. Deep-seated ulcers in the joint is also caused because of the Majjavasrotas problem. Okay, next. Shukravaha Mula Sthana. I think something is wrong. I will just go back. Majja. Okay, that means this is finished. Viddha Lakshan has not been mentioned by Sushrut. Majjavasrotas is not mentioned by Sushrut. That's why the next Srotas, that is Shukravaha, reproductive system. Shukravaha Vrushano Melam Shefascha. So Vrushana is a scrotum, and in that there is a testis, and Shefa is a genitus, that is the penis or the vagina in the females. Shukravahe Dve Tayoramulam Sthanau Vrushanaucha. When you consider the female gender, then Sthana is also a part of Shukravaha. As per Charak, the site of origin of Shukravaha are Vrishana, that is testicles, and the Shefa, that is penis. As per Sushrut, the Shukravaha are always two. Charak has given each Srotasa as number one Shukravaha, one Pranavaha, one Annavaha, one number, only one number. But Sushrut has always given the pair. Rasavasrotas, 2 in number. Raktavasrotas, 2 in number. Shukravasrotas, 2 in number. So this is the difference in Charak and Sushrut. Charak has mentioned each Srotasa as only single, but Sushrut is mentioned each Srotasa as in pair, P-A-I-R, pair. Keep remember, because that's why here Shukravahe Dve. Dve means 2. Okay. Then he has mentioned the Sthana, breast, and the Vrishana, that is testicles, at a Mula Sthana. Okay. Dushti Hetu by Charak Vimansthan, Akala Yoni Gamanat, Nigrahat Atimaithunat, Shukravahini Dushyanti, Shastra, Kshara, Agnibhistata. So first word is Akala Yoni Gamana. Akala, performing sexual activity without proper foreplay. This word is related with the sexual activities. Foreplay means to stimulate each other. Male and female partners try to stimulate each other by kissing, by embracing. So this is called as a foreplay. Actually, before intercourse, there are some activities which are done by the male and female partners, that is called as a foreplay. So if you don't do the foreplay and directly start the intercourse, that's sometimes the problem with the any partners. Okay, so remember Akala Yoni Gamana. I think another meaning is also there. Personally, Deshpande feels that Charak or our Granthakar has explained in which Rutu how many times we can perform the sex. For example, in summer season, there should be frequency should be less. Once in only 15 days, you can perform the sex as per our Charak. In the Hemanta Rutu, when there is a lot of cold outside, you can perform every week. So if this is not followed, that can also be called as Akala Yoni Gamana. Okay, that means in the summer season, if anybody pair, husband and wife, tries to make more sex, then that can be the problem, Akala Yoni. And also another meaning we can take, for example, the reproductive period is the 5th day of the menstrual cycle to 15th day of that particular cycle. If it is not done in that particular period, another period is called as a Akala, not proper period for the sexual activity. So there are the different meanings of Akala Yoni Gamana. Okay, now next. Nigraha. Nigraha is a suppression of Shukraveg or sexual urge. Suppression of the Shukraveg or the, because there are, Ayurveda says the natural physical urges should not be controlled. Na vegan dharayet. You remember Ashtang Hruday. Na vegan dharaniya adhyay. You should not suppress the defecation, going to the stool. You should not suppress to the urination. That can have the bad effects. Sharik veg, physical urges should not be suppressed. mental urges can be suppressed. Na vegan dharani. Okay, so nigraha. There should not be excessive pressing or suppressing that particular urge. Then ati maithuna, excessive sexual activity. Just now I have mentioned that in the summer season, every after 15 days. If you do frequent sex in the summer, that is called as ati maithun. Okay. Then Kshastra, Kshar and Agni, applying the surgical instruments or any surgical procedure around the anorectal region or are concerned with the genital tracts, that can have the complication or side effect, damage to the nerves or the muscles of the genital organs. So that is called as a Shastra, Kshara, that is application of alkali, and Agni. That means if there are warts, for example, WARTS, warts, sexually transmitted diseases are there. And some dermatologist, he has given some ointment for the application or did some cautery that can have the complication to damage that particular urethral, what you can say, the muscles or the nerves, and that can be the problem with the Shukravaha. The main function of Shukravaha is fertility. That is very important. Now, Dushti Lakshana, Shukrasya doshat, if it is damaged, pathology, Klaibyam aharshanam, Rogam va klibam alpa ayu, Virupam va prajayate, Nachasya jayate garbaha, Patati, Prasravatyapi, Shukram hidushtam, Sapatyam, Sadaram, Badate naram. I know, the big shlok is there. But these are interesting shlokas because Srotasas are always needed in your examination, in your medical practice. Even in the Roga Nidan, when you do the practical examination in the hospital, there is a case taking. Do you know case taking? And there is a short case and long case. Short case for 15 to 20 minutes and long case for 45 minutes. Okay. So in short case, you have to examine only Vikruta Srotas. But in the long case, you have to examine each and every 13 Srotasas. This is the difference in short case and the long case. I hope you are understanding. I am talking about Roga Nidan hospital practical examination in the university examination. Okay. So first is a Klaibya. Klaibya is inability to perform sexual activity or erectile dysfunction. Your penis cannot be erect. That is the problem. That is called as erectile dysfunction. Because there should be erection, there should be a little bit hardness, and then penetration is possible. Then your male penis can enter into the vagina. That is most important. Next is a aharshana. Aharsha. Harsha is a sexual satisfaction. But if Shukravasrotas is damaged, there may be problem in orgasm. ORGASM. Orgasm, when there is intercourse, male and female, penis is entered into the vagina, friction is there, and all the movements are there, say for example 2, 5, 10 minutes, and then the ejaculation of semen. After the ejaculation of semen, and when the female gets satisfaction, there is a typical symptoms which are called as orgasm. Happy feeling, contented feeling. Yes, it has been done very nicely and we both have enjoyed. That is called as an orgasm. In Ayurveda, it is called as a harsha. But when Shukravasrotas is damaged, the Lakshana will be aharshana. Next, klibata, alpayu and virupata. The person will be impotent, cannot perform the sexual activity. He may have short lifespan because Shukra is related with the Oj is related with the immunity. So when immunity is less, alpayu, less lifespan. Then disfiguration. His weight loss may be there. He may have the dyslipidemia and the obesity may be there. When Shukra is damaged, Shukra reproductive tissue is damaged, there may be lot of hormonal complications. Try to understand. Next, his spouse, that means a female partner, will be having frequent abortion because in the reproductive system of the male, if the penis is having the infection with sexually transmitted diseases, STD, or venereal diseases, because of visiting to the prostitutes or visiting to the sex workers, if she is infected, he will get also the syphilis, gonorrhea, AIDS, and that can problem for the partner. And the partner will also suffer these infections, and she will get abortions. Okay, his spouse and children will be suffering from illness. You know very well that if the wife gets the infection from the husband, like HIV, that mother will give this HIV infection to the newborn child. Are you understanding? So this is the explanation what the Charak has given at that time. Now we have the full understanding. Shukravaha explained by the Sushrut also. So with the Lakshana, first is of course the klibata, klaibya, impotence, erectile dysfunction, no erection and no firmness and sturdiness till the intercourse. Okay. Then here again, a few days back I have explained, I have on the YouTube channel Ayurveda Academy sex education playlist. My all dear friends, please check each and every video from sex education. Very interesting that particular videos are there. So you will be getting a lot of knowledge about the sexual education. Okay. Then chirat prosek, delayed ejaculation of semen. Okay. So lot of time he will do the intercourse, but the semen will not come. Then rakta shukrata, very rare, very rare. But if the patient is having sexual transmitted disease like herpes, for example, he may get the presence of blood in the semen during intercourse. Okay, because of the injury, friction will be there. Ulcer, if it is ulcer, then it will start bleeding. That is called as a rakta shukrata. Okay, bleeding during the intercourse. Next Srotas. We have completed Majjavasrotas today. We have completed Shukravaha today. And now we have started about the waste products. Mutra, Purisha, and Sweda. So first is Mutravahasrotas, urinary system. Mutravahasrotasam bastir mulam vangshanucho charak vimansthan. Mutravahe, again, dve. Tayor mulam basti medramcha. This is a printing mistake. Dr is not there. Okay. As per Charak, the site of Mula Sthana, origin of Mutravahasrotas, are Basti. These are the controlling organs. Mula Sthana is not actually where the urine is formed. Okay. But where that particular Mula Sthana is always have some influence on that particular Srotasas. So Basti, urinary bladder, and Vankshana, that is the pubic region, whole pubic region, pelvic region, okay, lower abdomen. Then as per Sushrut, the number of Mutravahasrotas are 2 in number, and site of origin are the Basti, that is urinary bladder, and Medra, that is urethra or the penis. Now, Dushti Hetu, Mutri Todaka Bhakshastri Sevanan, Mutra Nigrahat, Mutravahini Dushyanti, Shirnasya Abhikshatascha. Let us see the meaning. Mutri Todaka Bhaksha. Mutri Todaka Bhaksha and Stri Sevana. Consumption of food, Bhaksha. Consumption of food, eating and drinks when one is having urge for micturition. That means the person wants to go to the toilet. He may be traveling or going with the family with the picnic, and there is not in between dhaba or the hotel or the toilets, and he is driving, but then he has got a good food stall, but there is no facility of the toilet, but he eats. He is having the desire first to micture it, but he is not able because there is no facility, so he eats. That can damage to your Mutravahasrotas. And also performing sexual activity when one has the urge for micturition. So whenever you want to do sex, first go to the toilet, do the urination, and then whatever you want to do with the sex you can do. But having the desire for micturition, not going to the toilet and doing the sex, that is not at all correct. Are you getting my point? Okay. Mutra nigraha. Again, which chapter of Ashtanga Hridaya? Navegan dharayet. Navegan dharayet. So physical urges, physical desire, like going to the stool, going to the urine, going to for the sleep, desire for eating, desire for drinking water, chit and trut, it should not be suppressed. Whenever you feel hungry, eat something. Whenever you want to drink water, drink water. Whenever you want to go to the toilet, go to the toilet. So Ayurveda says Vega. Vega word is very important. Vega means urge. Vega means desire. Don't suppress physical desires. Navegan dharayet vata wind mutra kshavatruchadam nidra kasa shramashwas jurumbashru chardiretasam. Oh, sir, my God, what you are talking, sir? My dear friends, some shlokas one has to remember for the lifetime when he wants to learn Ayurveda or practice Ayurveda. I am practicing Ayurveda, that's why I remember few shlokas from my college days. I know, it's for you, it's difficult. But be comfortable, be slow. Whatever possible you do. Remaining, forget. Just know the meaning and get a confidence. Don't bother about Sanskrit. Don't bother about shlokas at any subject, anytime. Relax. Just relax. Okay. Even if you remember few words, that is also okay. For example, somebody writes Mutri here. Can you concentrate here? Mutri todak bas dash dash dash. No problem. You can write in this way also. You can give only reference. Charak Vimanstan. Best? Yes, you can give only reference. That is not a problem. So Mutra Nigraha, that is the cause of problem. Then Kshina. Kshinasya, when the person is having Kshina Dhatu, very weak person. Weight loss is there. Damage to the rasa, anemic patient is there. Muscle wasting is there because of the cancer, because of the tuberculosis. Then he can get the problem of urinary infections because your immunity is less. When they are saying Kshina Dhatu, definitely immunity is less. And whenever immunity is less, always you get urinary tract infections. Remember my words. Then what is that? Abhikshatasya. When the person is having injury or trauma to any part of the body, that can affect your urine. Even especially damage to the kidney, damage to the bladder. Some accident when takes place, we don't know. It can damage to your kidney, it can damage to your bladder, it can damage to your urethra, penis. Anything can happen. No problem. Now Dushti Lakshana. Pradushtanam tu khalu esham idam vishesha vijnanam bhavati. Try to cursor, please cursor. Tadyatha atisrishtam atibaddham prakupitam alpalpa bhikshnam va sashulam bhalam sashulam mutrayantam drishtva Mutravahasrotas Srotansi Pradushtani iti vidya. Charak Vimansthana. 5th chapter. Sroto Vimani. So, passage of Atisrishta Mutra. Srishta means repeatedly. You have to go to the toilet every hourly, every half an hour. That may be because of the infection in the urinary tract, or you may have the diabetes mellitus. Remember, okay? You may have the prostate problem, prostate gland, benign prostatic hypertrophy, BPH. Okay? Then Atibaddha, reduce the quantity of passage of the urine. There may be stricture, especially after the gonococcal infection, sexual transmitted disease, you get the urethra blocked. Stricture is there, fibrosis. So that is Atibaddha Mutra. Maybe obstruction, then stricture or BPH, benign prostatic hypertrophy. Then Prakupita Mutra, abnormal urine such as the yellowish or reddish. Why reddish? Why reddish urine? Red colored urine? Stone, urinary stone, which may suggest dosha prakop in the body. Pitta prakop will be there. Okay? Alpalpa mutrata, little urine. Frequent passage of small amount of urine. Bahala mutrata, excessive passage of urine at a particular time. Lot of urine. Then, shula, that is most important. Painful micturition. Shula is a vedana, pain. आम्ही मराठीमध्ये उन्हाळी लागलं असं म्हणतो. In the summer season especially, when you drink the less water, there is always possibility that your urine is become high colored, bad odor will be there, lot of kshara will be there, no water, and then It can give the pain. Remember, dysuria. That is called, and it may be because of the urinary tract infection. You can do the routine urine examination and you will get a lot of pus cells. Okay, next. Now Sushrut, Viddha, Sushrut, Dushti, Charak, Dushti, Hetu, Dushti, Lakshan, Charak, Viddha, Lakshan. There is no Viddha, Hetu. Sushrut only mentioned Viddha, Lakshana, traumatic injury symptoms. Okay, because Sushruti is a surgeon. Tatra Viddasyat, what is that? Tatra Viddasya Baddha Bastita Mutra Nirodha Stabda Medrata. So Mutra Nirodha is the first symptom. Mutra Nirodha. Retention of urine. Urine will not come out because there is a stricture. Then Anadha Bastita. Swelling of the lower abdomen due to the retention of urine. Your bladder will be full and that will give you the swelling at the lower abdomen. Anadha Bastita. Can you see here this word? Anadha Bastita. Tatra Viddasya Anadha Bastita Mutra Nirodhaha and Stabdha Medrata. That is reduced movement of penis. Especially you will say, sir, what is reduced movement? I want to say that there may be some neurological damage or there may be some crush injury during any surgery or trauma. Then your urethra, penis is damaged, muscles are damaged, and you cannot get a proper erection of the penis. That can be considered as a reduced movements of penis. Okay, next. Next, Srotas, Purishavahasrotas, Mula Sthana. Purishavahanam Srotasam Pakvashayo Mulam Sthula Gudamcha. Charak Vimanstan, 5th chapter, Sroto Vimaniya. Purishavahe Dve Teor Mulam Pakvashayo Gudamcha. Sushrit Charirasthan. As per Charak, the site of the origin of Purishavahasrotas are Pakvashya, large intestine. You know what is the function of large intestine? Water is absorbed and stool is formed. Solid ghana part is formed in the Pakvashya, in the large intestine. Large intestine, no digestion, no enzymes. There is only water absorption and formation of stools is a function of large intestine. Then Sthula Guda, rectum, where the stool is kept ready for defecation. Because through the anal opening, sphincters open and you get defecation. But before that, it is collected in the rectum. So rectum is a collecting pouch, collecting bag. Okay. As per Sushrut, the Purishavahasrotas are two, always dve, 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 dve. Sushrut, dve, Sushrut, dve. Two, okay. And their site of origin are Pakvasha, large intestine, and Guda, that is anus. Now, Dushti Hetu, Sandharana, Atyashanat, Ajirna Adyashanat Tatha, Varcho Vahini Deshpande, Durbal Agnehe, Krishasya Cha. Varcha Vahini means Varcha means Purisha, stools, solid waste product, Mutra and Purisha. Some students, they make a big mistake of writing. They write Purushava. Oh, no. Purusha is a different and Purisha is a different. Here, P-U-R-I and Purusha, P-U-R-U. Purusha is a human being and Purisha, remember, Purisha here, can you see? Purisha is a stools. Okay. First is a Sandharanath. Again, if anybody want to go to the toilet, especially when the person is living in the lodge or common residing places and lot of huge crowd is there and lot of people wants to go to the one toilet, public toilet, and lot of what you can say that there is a queue for the going to the toilet. So he has to suppress the urge. Oh, I want, but there two people are in front of me. Public toilets. So there can be Sandharana. This can happen for some people. We don't know. Always suppressing the urge of going to the toilet. Then Atyashanat, consumption of excessive quantity of food that will make the indigestion and problem with the stools. Then Ajirna Adyashanat. Whenever there is Ajirna means indigestion and still the people is eating. He knows that there is a gas in my stomach. I don't want to eat, but still he is eating. That is called as ajirna adhyashana. Okay. Then durbal agni, when the person is not proper digestive fire, his jatragni is not working well, dhatvagni is not working well, panchabhutagni is not working well. That is durbal agni. Okay, that can the problem for the stool formation. Then krusha. Krusha is a very weak person. Weight loss. Again, this has relation with the oj or the immunity. And whenever immunity is less, there is always problem with this and that for this Srotas and for another Srotas. So weakness, because excessive weight loss makes a Vata Prakop. Dhatu Kshayajanya Vata Prakop. And whenever there is a Vata Prakupita is there, Rukshata will increase, dryness will increase, and that can be the problem for stools. Because they will be not pass, constipation will be there, hard stool, straining, no stools. That is that problem. Rukshata, Vata Prakop, Dhatu Kshayajanya Vata Prakop. Next, Dushti Lakshana. Pradushtanam tu khalu esham idam vishesha vijnanam bhavati tadyatha krichrena alp 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 little sa shabda shula pain ati drava liquid diarrhea ati grathita constipation ati bahucha upavishantam drishtva Purishavahasrotas nest srotansi pradushtani iti vidya. Iti vidya means one has to understand. Krichrena alpa alpa purisha pravrutti. Frequent passage of small amount of feces with difficulty. Ayurveda it is called as a pravahika. Amoebiasis, amoebic infection, contaminated, polluted water. So he has to go to the toilet 5, 6, 7 times, but going to the toilet, no stool, then pravahana, straining, and little stool with mucus. That's it. Again going to the toilet after half an hour, no stool, little. That is called as amoebiasis. Okay. Then atidrava pravrutti, frequent passage of semi-solid or liquid stools that indicates bacterial or viral diarrhea. You know that, loose motion, diarrhea. Ati grathita pravrutti, frequent passage of very hard stool, that is constipation. Then ati bahu pravrutti, that is frequent passage of large amount of stool, which is happening when there is a fat in digestion. Fatty substances are not digested and lot of stool, big amount of stool is coming out. That is called as a steatorrhea. In the modern language, modern medicine, it is called as a steatorrhea. Purishavah Viddha Lakshan, Viddha means Sushrut. Dushti Hetu, Dushti Lakshan, Charak Vimanstha or Sutrasthan. And Viddha Lakshan, Sushrut Charita. Tatra Viddhasya Anaha, Durgandha and Grathita Antrata. These are the 3 words. Anaha, distension of the abdomen with gas. Okay. Durgandha, foul smell, because he is passing flatus with some smell, flatus. And grathit antra, small swellings in the intestine. It may be tumor, it may be the volvulus, it may be the intussusception. Now, there are different problems of the intestinal coils. So that is explained by the Sushruta because he is a surgeon, Purishavahasrotas. Now next Srotas, Swedavasrotas. Again the Mula Sthana, Swedavahanam Srotasam, Medo Mulam Lomakupahacha. Medo Mulam Lomakupahacha. As per Charak, Mula Sthana, Mula Sthana are Medasa, that is adipose tissue, and the Lomakupa. Swed is coming out from the hair follicle. There are sweat glands behind the your epidermis and dermis. Okay, so that Lomakupa follicle, hair follicles, definitely they are there connected with the sweating. But fat, whenever there is an obese person, fatty, he get a lot of sweating. Remember those things. Also, Pitta Prakriti person also get a lot of sweating. Okay, Sushrut did not describe the Mutravahasrotas. Now, Dushti Hetu, Vyayamat, Atisantapat, Shita Ushna Krama Sevanat, Swedavahini dushyanti, krodha, shoka, bhay tatha. So first is a vyayam. When any person do the exercise beyond the limit, that can be the problem with the excessive sweating and person gets dehydrated because water will lost. Okay, ati santap. Santap here not angry, here exposure to the sunlight. If you are more exposed to the sunlight, unnecessary lot of sweating will come and that also becomes a dehydration. Shita and Ushna akrama sevana, abnormal or disproportionate exposure to the cold and hot substances. For example, it is a common rule. Whenever you are moving in the hot sun and when you come back to your home, or if you go to the college, or if you go to the office, immediately after coming from the hot surrounding, one should not drink the cold water. Never. Freezed water. No. This must be remembered. That means this is called as a Vyatyasat. Shita and Ushna Akrama. Whenever you are coming from the hot, just take some rest for 5 minutes and then little bit water or little bit jaggery for the Madhura Rasa, you can take slowly and steadily. Not immediately. Freeze the water should not be taken. Room temperature water slowly and steadily can be taken. Then Krodha, sympathetic system is stimulated, very much anger. That can also create the problem in the perspiration. Shok, that is a grief. When there is a lot of tension, sad things in the family or the society, then we get a little bit tensions, grief. And bhaya, that is again the fear, that also affect your Swedavasrotas. Next, Dushti Lakshana. Pradushtanam tu khalu esham vijnanam bhavati tadyatha asvedanam, atisvedanam, parushyam, atishlakshanatam, angasya paridaham, lomaharsham cha drishtva, Swedavahanasya srotansi pradushtani iti vidyat. Okay, so atisvedan, whenever your Swedavasrotas, that water and electrolyte balance is disturbed, you get a lot of excessive perspiration. Then atish lakshanata, excessive slimminess, unctuousness of the skin and the body parts. Paridaha, sometimes so much dehydration takes place that you get a lot of heat in the body, lot of heat. Pitta prakop will be there because Pitta and Sweda Ashraya Ashray Sambandha. Never forget. Pitta and Rakta is also Ashraya Ashray Sambandha. Pitta and Sweda is also Ashraya Ashray Sambandha. Physiological relation. Vata and Asti Ashraya Ashray. Kapha and Med Ashraya Ashray. Are you remembering Ashraya Ashray? This is short note is very important in any subject. Ashraya Ashray Sambandha. Okay. Paridaha, because of the excessive heat, Pitta Prakop. Loma Harsha, that is horripilation. Your hairs, loma, this body hair will be little bit disturbed. And Parushya, whenever there is a less sweating, dryness will be there, roughness will be there on the skin because no sweating is there. Atisvedana and Asvedana both are pathological. Okay. Now the last but not least, we have completed 13 Srotas. Please write down 13 Srotas complete. But now we will talk about some excess about the female gender. Because we should respect to the female, understanding the physiology from the female human body. So Artavvahasrotas, again, Artavvahedve Teor Mulam Garbhashayo Artavvahinyashchadamanya Sushrutcharya. Sushrut says that Artavvahasrotas are 2 in number and their sites of origin are, number 1, Garbhashaya. That is the uterus, most important. You know that. Female reproductive system. Then Artavvahi Dhamani. Artava and Raja. We have discussed already in the Stri Roga Prasuti Tantra subject. Please check my videos. Stri Roga Prasuti Tantra subjects, check my videos. There in the first lectures I have explained about Raja and Artava. Artava is ovum, O-V-U-M, Stri Bija, female gamete. And Raja is a menstrual discharge. Raja is a menstrual discharge. Now this Dhamani, Artava Dhamani is a fallopian tube where from the ovaries, the ovum will come on either side, either right or either left, and it will enter into the fallopian tube. And from the vagina, Shukra will come, and then both will unite. Shukra and Shonita, or the Stri Bija and Purishavahasrotas. Okay. Charak did not mention about the description of Artavvahasrotas. He has not explained. Okay. Dushti Hetu, Yatyartham Sevate Nari, Lavana, salty, Amla, sour, pickles, Guruni cha, Katu, very spicy, hot, Vidahini, Snigdhani, Pishitani cha, non-vegetarian. Gramya Udakani, Medyani, Krusharam Payasam Dadhi, curd, Shuktamastu Suradini, Kupito Anilaha. All this will Kupita Vatadosh. Raktam Pramanam Utkramya, Garbhashe Gataha Siraha, Rajovaha Samashritya, Raktam Adaya Tatrajaha. This is something about the Raja and Artava. Now, Artavvahasrotas Dushti Hetu, excessive consumption. If the lady, female, consume lot of salty substances, kurkure, murmure, wafers, popcorn, all these are salty. Even putting the salt after even cooking and while eating, some people, they have the habit of adding excessive extra salt. In the cooking it is okay, but extra salt they take, that is not correct. Amla, sour, that is all the mango pickles and all these pickles. Katu, very, very spicy. Rasa and guru, heavy to digest food. Snigdha, anchas, fatty foods. So this will damage your reproductive system. So if infertility patient comes to you, you take care of, you see that whether there is any Artavvahasrotas Dushti Hetus are there. You must check whenever the patient comes for the Vandhyatva, not getting the child. Couple will come to you and you will have to ask these questions to the lady partner, female partner, or the wife. Excessive consumption of substances having Viddha, that is irritating quality, the quality responsible for burning sensation, acidity in the chest associated with excessive thirst and the dryness of the mouth. That is called as a spicy food or Vidahi food. Next, excessive consumption of Gramya, that is domestic animals, then Audaka, that is aquatic animals, and Anupa, that is marshy animals meat. So if you consume this type of the meat, that is non-vegetarian food, that can create the problem with the reproductive system or Artavvahasrotas in the females. Excessive intake of fatty substances like milk and milk products, curds and products. But here I will add, most important is the cheese. Cheese is not at all good for your health, especially excessive. Lot of people nowadays eat the maximum type pizza and all, or even the pav bhaji with cheese. Lot of cheese. That is not correct for your reproductive system. That can create the dyslipidemia, obesity, and PCOD, polycystic ovarian disease, PCOS. All these problems will start with the females. Even if she eats lot of curds, fermented products, that can also damage. Then Artavvahasrotas Viddha Lakshana. Tatra Vidyayam Vandhyatva. That's what I am saying. Vandhyatva, that is infertility. Not getting the child even after doing normal intercourse for 1 year after the marriage, that is called as a Vandhyatva. Then Maithuna Asahishnutva and Anartavascha, these are the symptoms. What is first is a Vandhyatva. Just now I have explained. Vandhyatva is also called as a sterility, not getting the child. Then Maithuna Asahishnu, painful sexual intercourse. The lady will get problem with the vagina and the dryness will be there. Lot of infections will be there because immunity will be low, and that can create the problem during the intercourse. Then Artava Nash, absence of menstruation. That is called as a amenorrhea. So it may be the primary amenorrhea or the secondary amenorrhea. Because of the these bad habits, she may get the anemic condition. And because of the anemia, she will get not proper menstrual cycle. Okay, I think this is the case with the Lakshana and these particular 3 symptoms. I think this may be the end of our lecture, but by chance we have the 5 minutes. I would like to show you one another script, but before that I will have to shift my screen. I don't know how I can go with that, but I will try. First I will close this, and then I will try to share another these things. For example, I will like to go here, then I will try to find out. I don't know where I can find it out, but just give me a few seconds. Okay, I will try my level best to get it for you. Just a moment. Okay, here I can check it out. Just wait here. Okay. Yes, I think we have got it. We have got it. Okay. So my dear friends, this is a collection of the all shlokas from Pranavaha to Swedavasrotas. So Pranavasrotas Mula Sthana, Tatra Pranavahanam Srotasam, Rudayam Mulam, Mahasrotascha, Tatra Pranavahe Dvetayor Mulam, Rudayam Rasavahinischa Damanyaha. Shayat Sandaranat Lokshat, Vyayamat Chuditasya cha, Pranavahini Dushtanti, Srotanscha Anyascha Darunaihi. Dushti Lakshana, Pradushthanam tu खलु एषाम इदम विशेष विज्ञानम भवति तद यथा अतिसृष्टम अतिबद्धम कुपितम अल्प अल्प भिक्षणम व सशब्द शूलम उच्छ्वसंतम दृष्ट्वा प्राणवहान्यस्य श्रोतांसि प्रदुष्टानि इति विद्यात् अन्नवहानां श्रोतसाम आमाशय मूलम वामम च पार्श्वम अतिमात्रस्य. My dear friends, I request all of you, immediately you open your own purchased Roga Nidan book, whatever you have. That means me Marathi, Hindi, English, but from that textbook that you have purchased, you write down all the shlokas one after another in your notebook by your own handwriting. Please don't, because I don't like the students always ask, sir, please send me that PDF. Why to send? You take your own efforts, my dear friends. You write down by your own hands, and when you write down this thing, that will be remembered more proper. Don't always make a habit of ready-made food. Ready-made food will not digest long time. If you try to chew by yourself, if you try to cook by yourself, then that food will be very good for your health. Always fast food. This is sending the PDF is like fast food or ready-made food. That is not at all good, my dear friend. You have to make the efforts of your own and writing those the shlokas in your notebook. Send WhatsApp to me, sir, I have done my efforts and I am getting the enjoyment of that writing the shlokas. Atimatrasya chakale cha ahitasya cha bhojanat annavahini dushyanti vaigunyat pavakasya cha. Dushti Lakshan, Pradushtanam tu khalu esham idam vishesha vijnanam bhavati tad yatha anannabhilasha arochak avipak chardi cha drishtva annavahanyasya srotamsi pradushtani iti vidyat. उदकवहानां श्रुतसाम तालु मूलम क्लोमम च. दुष्टि हेतु औक्ष्ण्यात् आमात् भयात् पानात् अतिशुष्कान्न सेवनात् अम्बुवाहिनी दुष्यन्ति तृष्णायाः च अतिपीडनात्. दुष्टि लक्षणम प्रदुष्टानां तु खलु येषाम् इदं विशेष विज्ञानं भवति तद्यथा जिह्वा तालु ओष्ठ कंठ क्लोम शोष पिपासां च अतिप्रवृद्धां दृष्ट्वा उदक वहान्यस्त श्रोतांसि प्रदुष्टानिति विद्यात्. रसवस्रोतस रसोति वृद्धो हृदयोत्किलेदं प्रसेकं च आपादयति. रसे रक्षम श्रमः शोषो ग्लानि शब्दा सेष्णुता रसक्षये हृत्पीड़ा कंपशून्यता तृष्णा च. All shlokas are important. You have to find out in your own purchased textbook. रसप्रदोषित व्याधि अश्रद्धा अरुचिः आस्य वैरस्यम अरसज्ञता रुल्लासो गौरवम तंद्रा सांग मर्दो ज्वरस्तमः पांडुत्वम श्रुतसाम रोदः क्लैब्यम साधः कृशांगता नाशो अग्नेः अयथा कालम वलयः पलितानि च. वलय wrinkles and palita gray hairing, early gray hairing. दुष्टि हेतु गुरु शीतम अतिस्निग्धम अतिमात्रम समष्णताम रसवाहिनी दुष्यन्ति चिंतानाम च अतिचिंतनात्. My dear friends, this is all for today. We will see you tomorrow for the Stri Roga Prasuti Tantra Vijnan at 7 p.m. Thank you very much for your nice cooperation. I wish all the best and take care.